Good morning, everyone, and welcome to Western Victorian Primary Health Network Primary Care Orientation for 2021. It's great that you can join us on this early morning, and we hope to showcase just how excellent the PHN is and how we can support you. I'd like to hand over to our Chief Executive Officer, Rowena Clift, to start the presentation.
Thanks, Katrina, and also welcome everyone to our orientation this morning. What an amazing time to be joining primary care as we're in the midst of one of the biggest public health measures I've ever known in healthcare, and really challenging times also. So we're really pleased today to demonstrate to you a number of areas in which the Primary Health Network will be able to support you to do what you do, and that's be great doctors. So we're here to assist, we're here to support, and we'll just go through a few things today. Thanks, Katrina. I'll acknowledge the traditional custodians of the land on which we meet today, and just to remind you that we cover a large number of lands. So there's the Wadawurrung, the Gudjijan, the Garrabunud, Kirrawurrung, Gunditjmara, Djabwurrung, Wodjabuluk, Djadjawurrung, Djadjawurrung, Wagala, Jadawa, Djapaguk, and the Wurundjeri peoples. We acknowledge their diversity, their resilience, and their ongoing place that Aboriginal and Torres Strait Islander people hold in our communities. We pay our respects to elders, both past and present, and we commit to working together in the spirit of mutual understanding, respect, and reconciliation. And I also wish to extend that respect to any Aboriginal people connecting with us today. So just a little bit about PHN. So this is the map of the Victorian PHNs, and we're here to support the very best practice in primary health care across our region and across Victoria. We cover a population of approximately 600,000 people. We are one of 31 primary health networks and one of 6 in Victoria, and we're a members-based organisation. So you can see the breadth of the landmass in which we cover. Thanks, Katrina. So we know through our work and the way we review the data that we've got quite a few challenges in our region. We've got numbers of chronic conditions. There's certain health behaviours that are influencing people's health and well-being, a lot of social determinants, and that really came out through COVID. We've also got an ageing population, mental health issues, and Mick will go through that, and also issues around how we connect the system and how we communicate to each other so that our patients can move between providers as quickly and easily as possible. Obviously, we've got some workforce issues the further out we go towards the border of our catchment, and a really important focus on Indigenous health. Thanks, Katrina. So if you just want to remember 3 things that we do, takeaway message is that we support general practice, we support you to do what you need to do. We also commission or purchase services where we see a need. So that may be services around mental health, it might be services around immunisation, for instance. And the other important thing is that we integrate local service systems, and you'll hear from Health Pathways, which is also a really important way that we come together and bring services together. We have our own priority areas set by the Commonwealth: mental health, Aboriginal Torres Strait Islander health, population health, workforce, digital health, aged care, alcohol and other drugs. So they're the things that we have to focus on, but we also see that these are often reflected in our examination of the health needs of our communities. So we have a 9-member skills-based board, and there's also clinical councils and community councils. They're your voice. They're there to represent you and your colleagues. So if you have concerns, you can certainly raise them with our councils. We also have 8 GPs who are working as what we call clinical leaders in a range of areas: preventative health, media, and and health pathways in a few other areas. And so we really ensure that we get the voice of general practice when we do our planning. Thanks, Katrina.
Thanks, Rowena.
I'll hand over now to the very talented Cara Miller, who leads our Health Pathways program.
Thanks, Rowena. Sorry, I'm a bit dark over here. I'm zooming in from Horsham this morning. So good morning, my name's Cara Miller and I am the Health Pathways Program Lead for Western Victoria PHN. And this morning I'll introduce you briefly to Health Pathways. Thanks, Katrina. So Health Pathways is an online web-based portal designed to support primary care clinicians in the assessment, management and referral of their patients. It contains many locally agreed, condition-based, but also symptom-based guidelines and specific information about local services and how to refer to them. It also includes information for patients, reference material, and educational resources. So we have approximately 850 pathways that have been developed by our team of clinical editor GPs in collaboration with specialists, subject matter experts, peak bodies and agencies according to best evidence and in consideration of the local context. So whether you're based in Ballarat, Geelong, Horsham, Warrnambool or anywhere in between, you can be confident that the information is relevant to you and the information on the referral pages reflect the services that are available in your area. Basically, it tells you how things are done around here in the Western Victorian health system. Western Victoria Health Pathways, we take a proactive approach to pathway development and we've regularly taken the lead in developing new pathways and guidance to support GPs in response to emerging areas of medicine and to changes in legislation. Thanks, Katrina. So this is just the home page and on the left-hand side is the table of contents. The arrows indicate landing pages that can be opened and expanded to view further related pages. In the search bar, that's the main search place that people go to find what they're looking for. You can just enter a search term and a range of pages will be listed for you to select the appropriate page that you're looking for. In the centre, you'll find our latest news. This is the latest relevant health news or alerts from our region from the Department of Health Vic. You'll also see the latest list of new and updated pages. On the right-hand side of the page, importantly, install desktop icon. It's instructions on how to add health pathways to your desktop, and we encourage you to do this so you can access it every day. And then Health Pathways is also now designed to be used across tablets and mobile devices. So under About Health Pathways, you'll see a link to instructions on how to add the application to your phone. Thanks, Katrina.
Thanks, Cara. Now we'll hear from the Workforce Development team, Katrina Martin.
Hi everyone, my name's Katrina Martin. I'm from the Workforce Development team. I'm the program lead and KP is part of my team as well. So I'm just going to spend a few minutes giving you some information about Workforce Development Program. So the Workforce Development Program aims to improve capacity of the primary healthcare system to deliver better outcomes for patients and the community in Western Victoria. We do this by developing and delivering initiatives that target the healthcare workforce through four main areas. These are education, general practice support, improving connections and addressing workforce gaps. And I'll just go through those in a little more detail on this slide. So we deliver education and training on topics that are relevant to primary healthcare providers in our region. We support general practitioners and other professionals in primary care practices by providing access to education, supervision, support and mentoring from colleagues and specialists. We also strengthen relationships between primary care healthcare providers and the broader health system, and today's actually an example of that work. Through planning, advocacy and partnerships with health and workforce agencies, we also advocate for the filling of gaps in the primary care workforce. So I'll spend a little bit more time on the education and events section because this is where you'll probably most likely engage with our team. So Westvic PHN offers a broad range of education, training and networking events throughout the year. As stated previously, the aim is to develop the knowledge, capabilities and skills of people working in Western Victoria's primary healthcare sector. The education topics we deliver address priority health issues in Western Victoria, and our education program is developed through consultation with our population health team, health pathways, GPs and GP clinical advisors, and open consultation via Meeting Place, which you'll hear about soon from Hayley. So the Westvic PHN events and education calendar balances a mix of face-to-face and online activities, many of which are RACGP and ACRM accredited. Some examples of the types of education activities included in our program are webinars, face-to-face education, which is largely on hold at the moment due to COVID, networking events, Project Echo, which is an online learning experience that connects primary healthcare providers with specialists and professional experts via tele-echo sessions. And I do recommend following the link that I've included here to find out more and sign up for some of our upcoming echoes. An annual primary care refresher conference, which is a 2-day online conference, which is being held on the 29th and 30th of May this year. And this is held annually. We also have many other large keynote events as well throughout the year. Most of our Westvic PHN education sessions are also recorded and made available on our YouTube Learn page. So follow the link to find those and have a look and see if you can find something of interest to you. We also support a number of communities of practice and small and special interest groups in the region as well. So how do you stay up to date with our upcoming events? On the next page, KP. Oh, sorry, I didn't realise that hadn't flicked over. So the next page. So the Westvic PHN website, if you follow that link, you'll be able to keep up to date with our upcoming events calendar. The Westvic News, which is a fortnightly e-newsletter, you can subscribe via that link that I've included there. And there's also some previous editions. And the General Practice Communique, which Dee might talk about soon as well. And you can find our email there to contact us. Thank you.
Thanks, Katrina.
Thanks, and I'm handing over to Nick.
Good morning, everybody. Thanks, KP. I might get straight onto the next slide, but I'm here to talk about the mental health services and the system integration. So we have a range of commissioned services. As Rowena pointed out earlier, we have 8 priority areas, one of them being mental health. Mental health is probably our most significant funded program, but in essence, our role is about how we increase the efficiency and effectiveness of primary mental health and suicide prevention services, and to improve access and integration to primary mental health care and suicide prevention services. It's also about trying to ensure we have smooth pathways into other interfacing sectors such as acute care and tertiary services. We work within a stepped care model that's been designed based on a concept that we're trying to support. Yeah, just keep it there for a minute. Thanks, KB. We're trying to support people to access the right care at the right time in the right place. The type of mental health services and suicide prevention services that are necessary range from people who experience high levels of distress that impact on their circumstances and their ability to contribute and live contributing lives, through to people with new and emerging onset of illnesses or relapsing illnesses that may relate to people with low prevalence mental illnesses. So our services are designed to try and support people to access the right level of care, ranging from low intensity services, people with mild to moderate mental illnesses. There are people that have mild to moderate mental illness that might require structured psychological therapies that mirror the better access programs, but the PHN Commission serves are for people who are the hard to reach groups that are underserviced populations. So there is a particular criteria to support people that are otherwise not able to access mental health care. The next level of people with severe and complex circumstances that might experience enduring and persistent mental illnesses and require packages of care that relate to care coordination, evidence-based treatment combinations, and interdisciplinary input into their collaborative shared care planning and service delivery. There are also services commissioned for young people, particularly thinking about the Headspace platform, which is a precinct of care in our region for trying to support young people to access various levels of care. And therefore the core platform is for young people with mild to moderate mental illness. But we've also commissioned services around young people with complex and difficult circumstances. We also support our Headspace services to try to work through and prevent any wait list that might occur. We have services that are specifically designed for Aboriginal and Torres Strait Islander peoples across the region, and they relate to brief intervention service at the moment, and we're doing a lot of work collaborating with our Aboriginal community health organisations to work out how we actually develop these services under a social and emotional wellbeing framework. And we have a range of suicide prevention services. Some of that is directed through the psychological therapy services. And I just want to highlight that this is not, the primary care suicide prevention services are not for people with emergency or acute care needs. They're for people that you identify as being at risk with emerging concerns that could benefit from therapeutic services related to the reasons and the context in which their contemplation around suicide emerges. Next slide, please, Katrina. What I wanted to do was to introduce to you early in your work the initial assessment and referral decisional support tool that has been introduced into our Head to Help services. And we are looking to try and align this across the region in primary care, and also to closely align this with the state-based triage assessment scale that the tertiary services use across the state. The reason for doing this is that the initial assessment referral decisional support tool is a tool that is applied to an assessment, a mental health assessment, with a person that takes them through and has 8 domains that supports the tool itself. There are primary domains and then contextual domains. In the a credentialed mental health professional actually undertakes the assessment, and then at the conclusion of that assessment, the decision support tool, based on the ratings that the clinician has made, will propose a suggested level of care that might fit with the information that is being collected. Then, in collaboration with that person, they will then determine the best level of care that might benefit a person seeking help. And that ranges, as I said before, around self-care, where the aim is around self-management and low intensity services, which is typically minimal to no risk factors, but someone is highly distressed and seeking help. Most of these services can be guided and supported to reach online or low intensity services of a brief nature, up to 4 sessions that might help them gain some level of information and access to information to self-manage. The third level of care is at moderate to mild to moderate services, where there are clearly symptoms and circumstances that a person requires a structured therapeutic approach, and they are delivered through our PTS services and Headspace services for young people. They are also delivered through the MBS Better Access programs that you can refer to. STEPME is a service. It stands for Services for People with Enduring and Persistent Mental Illness, and that is for people with those enduring, persistent mental illnesses that, if they do not access a service that is well coordinated and well packaged, they may require hospital admission, or they may require access to a tertiary service for ongoing needs if we can't meet that need in the primary care space. And the fifth level of care in the IAR is actually, it indicates that people have a significant risk of suicide, self-harm, self-neglect or vulnerability, or they have a level of care with significant symptoms and problems that impact on the functioning in a way they can't independently manage their daily lives and roles, which indicates the need for more specialist levels of care. So the reason I'm introducing this to you today is to give you a framework for thinking about what level of care might best fit and be commensurate with the level of need that a person is experiencing when they're seeking help. And if you're not really clear about that, then to be aware that you can refer to the Head to Help services in our region. It's a 1-800 number that we will distribute, and a credentialed mental health professional will actually guide that assessment, make a rating, collaborate with the person and then with you to then guide the person to the right level of care to ensure there is a seamless continuum of care should that be of interest to you and your client. I think that's all I've got now, Katrina, but I'm happy to
take, Mick. That's great.
Any phone calls. Happy to take any phone calls, and we'll get that up there. If at any stage you're not sure in delivering your work, please feel free to contact us to talk about the levels of care.
Thanks,
I'll hand over to Hayley. Cara, sorry.
No, Hayley.
Hayley's disappeared. Do you want to skip to my section then, KP? And
sure. Can come back.
Move on to. I was going to make a joke about saving the best to last, but I can't say that anymore. So my name's Deanna Carley-Seabohm, and I lead the practice facilitation team that provide practice support in primary care across the Western Victoria region. As Rowena mentioned earlier, one of the 3 core functions of the Primary Health Network is to work closely with general practitioners and other health professionals to build health workforce capacity in the delivery of high quality care. While the slides I talk through today focus predominantly on general practice principles, practice support can and has often extended beyond general practice to include other health professionals as well. We'll stay on this slide though, KP. Western Victoria PHN delivers a range of valuable support services to primary care, health professionals and practices. And we focus on long-term and sustainable initiatives while advocating and supporting innovation through high-performing primary care principles. Our commitment to support practices to deliver on the underpinning principles of the quadruple aim in a localised high-performing primary care model. And these are named in the image on the slide there, which is patient experience of care, quality and population health, improved provider satisfaction and sustainable cost. Clinicians and practices throughout Western Victoria can access assistance from our practice facilitators to help guide them on the professional support and information available for them and their staff. Western Victoria PHN's team of 8 practice facilitators have had extensive training to support general practices and other health professionals across these services. Next slide. So how do we support primary care? So the team work with practice managers predominantly, however, our scope includes all staff. Therefore, it's not unusual for the practice facilitators to be invited to a GP, nurse or allied health team meetings and provide support to non-clinical administrative staff as well. Our practice facilitators can specifically support primary care providers in the following ways. You will note that I've bolded, and I won't read through them all because you can see them on the screen there, but I've bolded the quality improvement part of the slide. And I've done that. It's a huge passion of the PF team to work with the practices on how to prepare for quality improvement activities, how to run one in your practice, and how to measure the outcomes of those activities effectively. The team can provide you with QI toolkits, sample PDSAs, one-pagers in a number of clinical areas, including diabetes, Aboriginal health, mental health, suicide prevention, health assessments. I think you get the picture. Moving on to the next slide is an image that kind of gives a bit of an indication visually on how we work with general practice. And it's might be a bit small on the screen, but it talks through some of the areas that we provide support on. And I'll just highlight the digital health area with reference to GoShare and My Health Record, telehealth, secure messaging, those kind of areas of digital health. And you'll note that I've expanded the benchmarking report section. I think this is a critical part of how we support general practices to understand the data that you have in your practices. This data is now updated monthly via our GP hub on the PHN exchange, and you can access that information in real time at any point that you need. You just need to contact one of us to help you get access to it. How we support general practice, next slide, sorry, Katrina, is achieved by face-to-face support, including on-site practice visits, virtual phone and email support, and you can read through those options below. As Katrina Martin mentioned earlier, we do have a practice support newsletter known as the Communique. It does come out fortnightly to general practices and is an additional source of information related to not just PHN activity, but other external information that's very relevant to you and your practice. Next slide. Our approach to general practice engagement and support is largely decided by you. So as I've mentioned, there's a lot of ways in which the team can work with practices. However, we're guided by you and your practice team. We understand that every individual practice works differently from the next, and the practice facilitation team work hard to ensure you get the information you require at the time you need it the most. It can be challenging in a PHN environment, and you can see from the number of people we have presenting today that there's a lot of people and information in the team that would be relevant to you. So the practice facilitation team are very happy to be contacted as that first point of contact to put you through to the right area or person or information that you need. So how do you schedule some time with a practice facilitator? Basically, you can just contact myself or the PF team on qi@westvicphn.com.au. Sorry, Katrina, next slide. This webinar forms part of a broader orientation program where the key aim for practice facilitators is to establish that high quality relationship with you and listen to the primary care needs to identify requirements and indicate collaborative activities to improve efficiencies and effectiveness. And coordination of care for patients in your practice. So reach out to us. Our team will probably reach out to you, to those who attended this today, and we do offer our services to general practice for any new staff that that want to be oriented to the Western Victorian region and the PHN. Thank you.
Thanks, Dee. That was great. Now we'll just go back to Hayley to talk about meeting place.
Sorry, that was the worst possible time for my internet to drop out. Technical difficulties. Hi everyone and welcome. Good morning. I think I've got a minute, so I'll be quicker than that. I just wanted to say, talk to you about Meeting Place today, which is our online engagement forum or platform. It's only recently been launched, so we're still building the content, but have a look at it. Have a look around. We created Meeting Place in response to GP demand for additional engagement opportunities with the PHN. And the idea is we're, as a PHN, trying to put more and more into one place, which is Meeting Place here, so that you don't get bombarded from too many different areas. I think as Dee mentioned, there's a lot of us in the PHN working on different things. So we're trying to streamline that to make life easier for you. Some of the pages are open to public, some require registration, and we'll flip to the next slide, please, KP. And to register and to check out Meeting Place, here's the link. And I'm going to try and put it into the chat in a second as well. To register, you just have to give your email, password, a little bit of demographic information. Once you sign up, check your email for registration, activation email, click on that. And then quickly to the next slide, KP, please. And I just thought I'd highlight 2 pages, one of which I've got a little picture of here is the GP engagement group. This is a closed group specifically just for GPs where it's sort of, I guess, more relevant for general practices rather than the general public. And to actually access this group, you have to register for Meeting Place, and then there's a separate registration form for this one as well, because it's a closed group and we need to make sure it's just accessible for GPs. The other page I better give a quick mention to is our primary care orientation page, which is almost finished. So I can't have a screenshot for you today, but it will be there to watch this space. And on that page will be our presentation today and some introductory sort of presentations from various health services within the sub-regions, just to give you a bit more information about who's out there, how you can contact them and what they can help you with. So some of the key hospitals and other health services in our sub-regions. And I think that's about it after my rush, and hopefully that wasn't too fast, everyone. I don't want to keep you too much longer. So over back to you, I think, KP. Thank you.
Thanks, Hayley, and thank you to all our presenters today. We realise that that is a huge amount of information to take in half an hour, but we want you to know that we are here to support you in your journey, and Meeting Place is a great way to start, and all the health services presentations will be loaded onto Meeting Place for you to access, and please reach out if we can support you. So thanks everyone for attending, and looking forward to building a great relationship. Thank you.